alcohol for them was not the problem, it was the solution. They have trauma, they have anxiety, they're turning to alcohol as a friend.
2 glasses of wine, that's now become a bottle, that's now a bottle and a half. Actually, was that original issue, is that still there?
You're putting a different substance ingredient into your body, and therefore it will alter how you can respond to a situation.
Hello and welcome to Perspectives, a show by Priory where we talk about some of the big issues in mental health and addictions today. I'm Colin Quick and I'm Priory's Chief Quality Officer, and today we're going to be talking about the interaction between mental health and addictions. I'm joined on the panel today by Dee Johnston, who's one of our senior therapists, Dr Victoria Chamorro, one of our consultant psychiatrists, and Debbie Lonsdale, Private Clinical Pathways Director. So thanks everyone for joining us today. Now, as ever, it's really useful just to think about some of the statistics around this. And I just want to just throw a couple in before we really start getting into our discussion. And something from the UK government data, and that's stating that around 2/3 of people who start addictions treatment have also said they've got a mental health need. So a really significant number of people. There was a study by the University of Swansea that talked about 70% of young people with a history of substance misuse who've also got a record of mental illness. So there's a relationship there. There is something in there. And I just think it's just really useful. Maybe just to, Victoria, if you could, just set some of that scene for us around some of that, where that interaction comes from between mental health and addictions.
Yeah, as you were saying, there's a huge crossover between mental illness and addictions. There's lots of reasons for that. Some mental illnesses can predispose you to seek out substances. Some patients are self-medicating with substances. And then some drugs cause some mental illnesses. So there's a lot of reasons why there would be that overlap.
Okay, so there's some real interesting stuff that we can really unpick, I think, as we go through some of that interaction between things, some of the things that cause and effect, which are really, really interesting for us, aren't they? So, Debbie, I'm going to come to you around this one, which is just thinking through how do substances like alcohol and drugs, how do they affect conditions? Let's take some sort of common conditions like anxiety or depression. How can they affect those?
I mean, essentially, you're changing your ability to regulate. You're putting a different substance ingredient, if you like, into your body, and therefore it will alter how you can respond to a situation. And if you are anxious or if you have depression, you're already struggling with that mental health condition anyway, and then layer that on top with a substance or alcohol, whatever it may be, and there's just lots of layers for your body, for your brain, for your responses to be working through. So I really feel for people who have to navigate all of that, because it's really, really tricky, and your ability to be in control and make a choice around how are you going to respond is just compromised, I think, for a lot of people. And I know a lot of us talk about making choices, but when you have all of these things going on, it's not quite that black and white to people, I don't think.
Dee, just coming to you on that one, because I think that's a really interesting area to expand on. Is it all mental health conditions can be affected by addictions, or can all addictions be affected by mental health conditions? Is there where's the grey areas? Do they exist?
Yeah, it is a grey area, and sometimes there is a crossover. It becomes a chicken and egg. What was first, the mental health disorder, or was it the addiction? Did the addiction cause the mental health, or the medication, as Victoria explained? But the grey area, I think, is people sometimes fixate on the one, and the problem being, and we see this as therapists, they might have a substance use problem, whether that's alcohol, ketamine, cocaine, gambling, but they want to fixate on the mental health disorder because part of them believes, and in the early days it does have some sort of efficacy, that their recreational drugs or their opioids, not prescribed by the doctor, is actually assisting their mental health problem. So it helps me sleep, or it calms my racing brain down. So ADHD, for example, with cocaine, well, it helps level me out. So they don't want to acknowledge that they've got this actual addictive problem because they want to protect it. They want to hold on to it because that helps my mental health disorder. And then on the flip side, as Debbie said, that, when it's changing the neural pathways in your brain and you're becoming chemically altered and chemically addicted. The other part is that the addiction overrides the mental health, and now their obsession is they're not even thinking about their bipolar or post-traumatic stress disorder. And the obsession is now, I need to drink, I need to use, I need to gamble, game. So it does become a really grey area of what do we treat first. And I think the dual diagnosis and recognising that is so vital, because we can treat both alongside, but understanding that if we don't get a handle on the substance abuse, it's very difficult to navigate the support and treatment on the mental health disorder, because one knocks the other one out, then one feeds the other one back in again. And we're caught in this really painful, toxic cycle for people. And they get scared to let go of that stuff, because at some point, those drugs, that behaviour, it gave them some sort of peace. That belief in its self-medication efficacy in the very early days, I mean, it always ends up an absolute wreck. It's really hard to try and entice somebody away from that.
Okay, that's really interesting. So Dee, obviously, a lot of your work is very much in that immediate addiction space. Victoria, a lot of yours is very much more in the mental health work. But from your perspective, how much are you seeing that? We talked earlier on about some of those numbers. Are you seeing many people coming through with mental health conditions that also got those secondary substance misuse challenges as well?
Yeah, absolutely. I'm blessed to do both. And that does make, when you have a psychiatrist involved, we can look at both aspects of you. So it's the kind of dual diagnosis aspect. I think one of my patients told me something very pertinent the other day, which is quite hard hitting, where alcohol for them was not the problem, it was the solution, which is what Dee's coming back to. And ultimately, they have trauma, they have anxiety, and alcohol is the solution. When they're having interpersonal relationship difficulties, they're turning to alcohol as a friend. And it's about building those other better adaptive coping mechanisms that will help them rather than set them back. And so you need to unlearn the maladaptive ones and relearn new ones. And of course, the reason why alcohol and substances are so seductive is because they work, but it doesn't help you in the long run.
And whilst we've talked a bit so far about substances and Dee talked through kind of a whole array of substances that people might use, and we'll talk about those a bit more later on. Debbie, from your work, where do you see those more, what we often refer to as those behavioural addictions? Dee mentioned about gambling as a good example. Are you seeing much of the interaction there between those addictions and also the mental health challenges?
I mean, an addiction is an addiction to some degree, isn't it? Back to what you were saying, Victoria, the maladaptive coping mechanism that somebody has unconsciously lent on to cope with whatever's going on in their life. And so it could be gambling, it could be shopping, it could be love and sex addiction, it could be so many other what we class as behavioural rather than substance addictions. So I don't know that I would want to separate them out so much. I think an addiction is an addiction. And people have that relationship between their well-being, their mental health, and how they are coping with it. But I think then there are some maybe environmental, some social construct kind of elements that come in terms of which, and biological, of course, because substance and alcohol, then there are people that are more susceptible maybe, but their environment and what they have seen other people do or not do can influence unconsciously what people lean on to cope with their issues. So for sure, I think anybody that comes through with a behavioural addiction, and Dee, you might have thoughts on this, I think that initial mental health sweep around what's going on for somebody and how do we make sense of it, how do we join the dots, how do we formulate or unpick the reasons, then the mental health is as present with a behavioural addiction than with substance.
And is that your experience from a therapy point of view as well?
Absolutely. And we see it time again because it adds to the lack of self-worth. It's disabling a person's own self-belief and their ability to deal with something adaptively, because it's not me that can deal with it. It's my behaviour. It's that thing I turn to that takes away the pain, that takes me out of my head, that takes me out of a reality that I don't want to be in. It's the only thing in that moment that gives me that feel-good factor. We look at the reward system in the brain, and this is the most important thing about addictive behaviours, that when people look at somebody else and say, well, they've got mental health problems, they've got depression or they've got anxiety, but they don't seem to have this addiction problem. There's genetic factors, environmental, social, economic factors. But the other part of it is the reward system works on a much deeper level. So you might get the heady effect of you just want a load of money in a bet, you get a nice dopamine flood or a little jolly feeling from your alcohol. But if there's something really deep-rooted underlying that you might not even be overtly aware of or are aware of, the reward system isn't just I get the high and the hit, it's leveled out my pain. It's taken the noises out of my head. It's calmed me down. It gave me a sense of just being somebody, even if it's just for a moment. So the relationship with those behaviors is really insidious. It's very subtle. And that's why people don't see it happening, because by the time they're in that mire, that's when they start to notice the symptoms. But before that, it seems okay. It's justifiable. So the behavior is addiction. And as Debbie said, absolutely. And at Priory, we see that very much. Addiction is addiction is addiction. We treat everybody as the individual, and it's looking at their gateway drug of choice could be alcohol, it could be gaming, sex and porn, gambling, shopping, ketamine. But actually, the fascinating thing about it, the thought processes are all the same behind it, pretty much. I need to find people, places, or things to change the way I feel, to make me feel better, or get me out of a reality I don't want to be in.
So really interesting. People have been talking about that impact, and I guess some of it is about that short-term impact, that kind of the brief, literally the brief high that someone gets if you're taking drugs, alcohol, the numbing effect that might bring to the challenge of emotions, it making you feel different, it makes you feel more comforted, it may numb the effects of the feelings you're having. But there's got to be some, I'm assuming, some long-term effects on your mental health as well. So, Victoria, could you just the world of that could be lots and lots of variations in there, but just give us a bit of a theme or a bit of an idea about what effects these things can have on your very long-term mental health as well.
Absolutely. So I'll think about alcohol first. So alcohol is used as a party drug. We go out and we drink, and but that's not really what it does. Actually, it's a depressant, and it's a stronger depressant than any of our antidepressants are. So when Debbie was talking about, treatment's not working, reinforcing that feeling that you can't be helped, it really we can't counteract the strong depressant effects. So you take it to feel a bit better, and actually what ends up happening is you feel worse in the moment. Alcohol also is directly neurotoxic, so it does start damaging your brain. That ends up with people having wobbly feet, not being able to feel their feet sometimes, all the way through to certain types of dementias. And actually, we don't talk about that particularly very often. So yes, absolutely, it can cause depression, can cause mood disorders, but it also causes essentially brain damage, which is why I say to all of my patients, please, please, please take thiamine. If you're watching this, you might think you have heavy drinking, take some thiamine. You can get it from Boots. You don't need to talk to a doctor. That will help protect all your nerves. Another example that I was thinking of when you said that would be with cannabis. So cannabis chills you out. You take it to feel chilled out. And I have a lot of patients that have anxiety that take it to self-medicate that anxiety. Actually, when you look over weeks and months, it makes you more anxious, and it makes you typically very paranoid. So you're treating something for your anxiety that is actually in the longer term causing your anxiety. So that needs a little bit of unpicking sometimes, and there are more effective treatments to be had.
Thank you. And Dee, what's the impact when you see that long-term piece, maybe in some of your therapeutic work, where you have someone that maybe is a very long-term alcohol user or a very long-term drug user? Do you see that a sort of greater impact on their mental health, almost at that starting point with you? Do you see, because it's been so long-term for them?
Absolutely. Because they're now in that place of despair, and that's their normality. It's quite interesting sometimes when you sit with a patient who still kind of wants to hang on to their addictive behaviours or substances, they'll still kind of argue back a bit. No, I had depression. I'm saying, no, your alcohol is a depressant, and your drug use has caused your anxiety, and they still want to defend it a little bit. So again, you kind of give it a little bit of a time for them to come to terms with, because there can be a huge amount of self-shaming around that as they actually start to realise the reality. They get honest about it. And then there's this terrible internal moment when you think, so I did this to myself. I already felt low, worthless, stupid, not good enough, embarrassed. That's why I took that stuff in the first place. And now I feel low and bad and I'm struggling with poor mental health because of what I did to myself. So you have to hold that really carefully, not to let them fall back into a further place of blame and despair. But the positive thing is we say to them, look, you're not doing that stuff, whether that's, you're gambling to get away from reality, and there's a very high suicide ideation with certain addictive behaviours. We talk about substances, but sex and porn addiction, shopping, gambling, all the very tricky situations you can get into there. The suicide ideation rate is huge. And that's very scary for people to actually, one, say that they feel like taking their own life, and two, because of why. So it takes a huge amount of courage. But on the other side of that, it's hopeful because you're saying, well, now you understand how it happened and maybe why it happened. That doesn't give you the solution, but understanding it, talking about it, support groups, professional medical help, it's changeable. Our brains are wonderful things. We have something called neuroplasticity, and that synaptic plasticity in our brains means our brains have the ability to rewire. And hang on to that, because actually you have had a moment where we've had a laugh, or you felt good about yourself, or you didn't say something horrible. So things are already changing. You're not turning to your abusive self-behaviours now. So your brain patterns, if you like, are already changing. You're doing that good stuff without you even realising. So it's really important that somebody recognises that in the early stages of recovery.
I know that it's a different episode we've done previously, but just in terms of that long-term effect, ketamine, every opportunity I have just to talk about ketamine and the long-term effects on people's bladder and the irreversible damage that it does is just so alarming. So sorry, just an opportunity just to
No,
mention.
it's devastating, and I can honestly say therapeutically, I mean, in the years I've been working in rehab, I would probably say in the last 2-3 years I've seen more ketamine incidents and issues. In therapy sessions we say, please try not to break out the therapy session and break the therapeutic role. But when it's a ketamine patient, we have to know, even within that 50 minutes and an hour, they're going to need the toilet 4, 5, 6, 7 times. And these are young people. And as Debbie said, it's that invincibility at the time when you're in the high of taking drugs. And especially when you're younger, you've got that natural invincible feel, haven't you? You don't think you're the one it's going to happen to. But the escalation we've seen in that is actually quite devastating. It's a great point, Debbie.
We've talked quite a lot actually around the kind of substance misuse piece, the drug and alcohol use, and we talked a little bit earlier around behavioural addiction as well, and we got some really good examples there. I think that's a lesser explored area about how that can start impacting on someone's mental health. So Dee, just from some of your clinical experience, how does that start showing itself? We talked about all those sort of gambling is a really well-known one, but then we talked about sex addiction and gaming addiction. How does that start impacting on someone's mental health as well?
Well, it's that form of self-neglect again. So whatever your mental health diagnosis was before, you'll start to ignore that because the addiction side of it becomes all-consuming. You might stop taking your medication or going to your support groups or your therapy sessions, or you might still be taking your medication, but the chemicals or the behaviours that you're doing addictively are now negating the efficacy of them. It can exacerbate your conditions, which drives you either further into more harmful behaviour, or actually what I see often is patients just give up. Nothing's making me feel better. So they go into a really frightening place of despair. And that there's a hopelessness and a sense of helplessness there, that nothing or nobody can help me. But I think the primary thing is their focus switches from maybe what the core issue was, maybe a mental health diagnosis, and that's completely segued for their addiction. So everything, stopping what you did before for your mental health is harmful in itself. Adding another layer of toxic, dangerous behaviour makes you even more vulnerable. I think the thing with some of this with it, they get a feeling of invincibility as well, that the bad stuff, the bad consequences happens to other people. It's not happening to me. And that's where it gets really, really worrying, that a person doesn't even realise how vulnerable they are. You're already vulnerable with your mental health anyway. But now you've actually lost sight of how vulnerable you are. That feels normal. And the worrying thing is that they've kind of leveled out to this is how I feel all the time. But I don't want that to change, and I'm terrified of change, even though if I partly know it will. it's then the embarrassment. They might not want to go to their doctor or the therapist and say, well, actually, I've been self-medicating, or I've been gambling, or I've not done my exercise, I've not gone to my support group because I was gaming for 24 hours, and not actually realising the physical harm it's causing themselves, as well as the additional mental harm.
Debbie, how does that kind of confirm with some of your clinical practice as well?
I think it's a huge area, and I think there are some quite high-profile people coming into view with their stories. Like I think Peter Shilton did a talk about gambling and the effect it had on his life, the footballer, and he, as an event recently where he spoke, and it was really interesting to see the journey that he went on and the impact it had on his life. And he had lots of money, so I guess he could probably ride the wave a bit longer than some other people could. But the financial impact of some of these behavioural addictions can be huge, in terms of needing to find the money to fund things, shopping, gambling, whatever it may be. And then the impact on relationships and the family, and whether you can then do things as a family, or whether you can move house, or whether you can pay the bills, and then relationships can dive, and that can be really, really impactful. And then your self-worth and your your self-esteem. And for me, people's self-esteem is the core of you being a robust human being. So once these behavioral addictions affect your self-esteem, that's for me, a real danger zone, that then lots of other things can come in, and suicide ideation can be an option because I just don't know how to get out of this. So it can escalate really, really quickly for some people. So I think it's good that we are seeing high-profile people talk about the impact and acknowledge the fact that it happened to them, even though they're these really successful people, apparently. And then that there is also a way through, that you can unpick it, you can acknowledge it, you can press the stop button with lots and lots of support and lots of, kind of thought through plans around you. But I don't think we should underestimate the impact or the unraveling that can happen in someone's life with all of these behavioural addictions.
I want to just bring us to something that we've actually talked about on previous episodes of Perspectives, because there's that growing work and that growing evidence base and knowledge, and I think public perception around autism and ADHD. And so that question about, well, how does that get affected by addiction? Or is there something inherent in some of those conditions that lead someone to become more prone to an addictive behavior? So, Victor, I'm going to come to you first on that. There must be something really interesting in that setting.
Yeah, absolutely. I mean, I see quite a lot of my addiction patients do have another diagnosis of ADHD or autism, and we pick it up when they come into for a detox or an ATP program. Um, there are factors in both of those conditions or neurodiversity that would make you more predisposed to having a substance misuse or addiction problem. But also it's a form of self-medication. So, for example, ADHD much more likely to have impulsivity, which is quite a high risk factor of having some substance misuse. But equally well, as Dee was saying, the stimulants paradoxically make your brain feel more relaxed. And so they're self-medicating that experience. People that have autism, for example, really struggle to have connection with other people, even though they might be desperately seeking it. And a lot of the drugs will make you feel loved, for example, makes you feel comforted. It's the same neurotransmitter pathways. So you can see that is an easier fix than maybe going out there and being rebuffed by lots of social interactions.
So you mentioned something there I thought was really, really interesting to bring us all back to. I think actually most of you mentioned it along the way in some place, which was around self-medicating. So I'm going to come to Dee first of all. Dee, just explain to us what do we mean about self-medicating in this circumstance?
It's a good question, because it is a phrase that's kind of talked about a lot. And self-medication is when you take ownership of the substance or the behavior that you have discovered is alleviating an issue for you, whatever that issue is, and giving you that reward that you're seeking. So it's nothing that's regulated. It's something you've taken on yourself. So your doctor, your GP might prescribe you something. So that's actually a regulated prescription. But self-medicating is that desire to use or take a substance or a behavior in order to make you feel better. The problem with self-medication is because it's totally unregulated, you want more and more and more. So your tolerance levels adapt to it. So your original need for however much it was, you kind of leveled out in it. So we need more. The other issue with self-medication is it becomes a very secretive thing because you don't want people to start actually seeing how much you're doing. So they can front it out and use a certain amount in front of people or behave. But self-medicating is a serious issue when we realize it's become a private, secret part of their world. They want to protect it. They don't want people to know in case they want to stop it, the embarrassment, the shame, the fear, and even the fear of stopping doing it because the chemical dependencies hit in, even with behavioural addictions, the dopamine flooding. There's that frightening moment with the gambling addict when they realise the drug that they're addicted to, they're actually creating themselves by acute dopamine flooding. But on the other side of that, they're terrified of letting go of self-soothing, if you like, self-numbing, because they don't know any other way to do it. So it becomes even more hidden and even more dark for fear of somebody else saying, I think you've got a problem. They don't want that to happen. So self-medication is that taking ownership of a substance and using it in an abusive and harmful way.
Debbie, for you, that self-medicating piece, is that something that we see across all areas of potential mental health issues? Because we talked about anxiety, we talked about depression, autism, ADHD. There's a whole range of other conditions, psychosis that sits in there. Is that something that we see prevalent all the way through?
Yeah, I think Dee explained that really well, actually. And it's a way, again, of having an element of control. I think I use that word a lot, but in terms of what choices do I have? What can I do about my situation? And that is an option for anybody in terms of self-medicating. And people may have done it casually without realizing. It made me feel better. It helped me manage a situation in any mental health setting or any mental health situation. So I think it's good for everybody to check in with themselves around, is that something that I can identify with? When have I done that? Is that a danger zone for me? Can I see it's increasing in frequency or volume? So again, in terms of people with good mental health, we have a good self-awareness and good checking with ourselves, and that little kind of sweeping of what's going on for me, what do I need, what am I leaning on to cope with day-to-day issues. Is there anything in there that's creeping into an unhelpful dynamic? And like Dee was saying, and then and that's where you might then identify or define it as self-medicating when it's become a regular crux, a regular thing that you're leaning on for any mental health, which then could evolve into an addiction because you didn't really intend for it to go there.
Okay. We're going to talk a little bit about treatment in a minute, but I thought what would be really useful, we talked a bit about self-medicating, a few other things in here, and it's always really useful, I think, for people watching us to think about, actually, that's great, you've told me all these things, give me all this knowledge, but actually, what can I do about it? So from maybe just one quick word of wisdom from each of you about how you can do something to help support yourself if you're self-medicating. What might be something to look out for or an intervention that might be helpful? I'm going to be very even about this. We're just going to work along the line. So we're going to start with you first, Dee.
It's very easy to say, get honest, because that's a very frightening thing. And every day becomes every day and we're justifying how much we're using. But I think if you can just sit down and it helps to write it down, because there's so much going on in your head. If you write it down, you slow your thought processes down, it becomes more tangible. Actually, when I started my little reward, what was that about? Oh, it was work-related stress, for example. So I did the often referred to wine o'clock thing, 2 glasses of wine. That's now become a bottle. That's now a bottle and a half. But actually, was that original issue, is that still there? Really address what you're doing instead of just, it's not that bad. No, write the units down, write the amount you spent on it. It's not about berating yourself. Don't use negative, chastising language around it. But get really honest with yourself first. It's being able to internalize and self-reflect, but without that punitive self-talk. Just say, like, if this was a friend, I wouldn't be saying, look at what you've done, look how much you've used. Did you realize it was out of control? A little bit of self-compassion, but start with a really honest inventory.
Brilliant. Thank you. Victoria.
I suppose the one thing that I would say is to reach out to somebody. I think if somebody is starting to have that question of, is this a problem? Should I be reaching out? Then the answer is absolutely yes. I have a lot of patients in my clinic who really have come to me to ask me, is this a problem? And that's completely okay. So I think as soon as you start feeling ashamed of your behavior, you start hiding it, it becomes the only thing you want to do, or using it very regularly, or there's been a change in the pattern, then absolutely these are all red flag signs that things are becoming out of control. And definitely reach out, even if you don't know the root of the problem or how to get yourself out of it. That's why we're all here. So just yeah, reach out and tell somebody. I don't think you even have to say what's necessarily going on. Just, I'm struggling, things are not going well for me, and I need a bit of help. And I think that's the first step.
So from that, we talked a bit about those pieces that people can do to help themselves, and that's really important. We know that's that really important first step for everyone. Sometimes, though, actually, someone needs treatment. Someone needs active treatment provided by a health service that can really deliver that. So I guess the question I think might be interesting for people to understand is, do we just treat the addiction, or do we treat the mental health problem, or why is it important to treat both of them at the same time? So, or how do we do it? So, Victoria, give us a view on that to start with.
So the first thing I would say is, if you have an alcohol problem specifically, don't stop drinking. Do reach out. Stopping drinking can be incredibly dangerous. So the important thing is to be detoxed slowly and carefully by a medical professional. So that's the first thing I'd say. About your question about treating the mental health and the substance misuse, it's a tricky one. Obviously, I think when you're looking at dependence levels of substance misuse and alcohol use, no one's doing that for fun. So there is often underlying reasons why that might be. You do need to be sober to be able to engage in the treatments and for the treatments to work. And I mean that with psychology and with medication. So that is always the first step, is a kind of detox period. And then it does take a little while for the brain to settle, to be able to not be under the influence of the substances, longer than you would be drunk for example. So with my patients, I generally say a couple of weeks. We see how things go, let things settle, don't rush into these things, while we're giving you a lot of support. When we're looking at the neurodiversity aspects of things, these are lifelong diagnoses. And again, it's not something that I would want to rush into. A period of monitoring, a period of assessing how you are. A lot of my patients might not have been themselves for years. And actually, what does that look like? And these are things that you can all explore with professionals to help you through it.
Okay, brilliant. Thank you. I just want to build on that a little bit with for yourself, maybe, Debbie, is that we talked a bit about the timing of things there. There's always, I guess that's always going to differ for people, but is it something you go, right, I'm going to treat the mental health problem. Once the mental health problem is all sorted out, then we'll treat your addiction problem, or do we treat the addiction? And once that's all done, then we can treat the mental health. Again, that's a tricky one to get right, I guess, but thoughts around that?
And wouldn't that be great if we could just put it into an order? And there are certain brains out there that would like that to be a bit clearer, I think, in terms of, I'm going to do one, then I'm going to do two, then I'm going to do three, and I'm going to do them one by one, and then they're going to be contained. So I know that some people do approach us and ask us to, can you help me do this in order? I remember speaking to a psychiatrist many years ago who talked to me about addiction and mental health, and talked about, I always try and think what's going to have the most impact first, or what's going to be the most dangerous thing for that person, to treat them first and then work down. So if you're going to put an order around it, maybe it's thinking in that kind of sort of filter. And therefore, with the high level of drug or alcohol use, it would be the detox, because we need to help people clean the system out and regulate. And people can have complicated withdrawal reactions, so with them, people need medication or lots of round-the-clock support to do that. So I think that would be the first thing for anybody with that high level of usage.
And Dee, I want to come to you last on this one, because I think it's a really interesting piece about what does it mean as a therapist if you've got someone with what we often refer to as a dual diagnosis, a significant mental health problem plus an addiction problem. How do you adjust what you do? How do you have to make sure that you're delivering the right things? There are ways, some people better at coming in, you've got a certain type of conditions that mean you're better off in a group setting or a one-to-one setting, or is it something, how do you adjust what you do?
It's treating the person as the individual, and that's the most important thing. We know the diagnosis, And sometimes, as Victoria said, there's not an original diagnosis, but it becomes overt as they get sobriety and we actually see what's going on for them. So it's about holding that person safely and acknowledging everything that's going on. Because as Debbie said, look, addiction is such a complex thing. Mental health is complex. We can't put it all into this is the depression box, this is the anxiety. Even with neurodiverse issues and other mental health disorders, there's so many crossovers in the symptoms. It's about giving that person time and nurture, because when somebody is in such a bad place, to the point they are self-harming addictively, the one thing they're not good at is nurture and time and patience. So we have to teach those skills as well. But it's treating the addiction, and obviously there's safety reasons and ethical reasons until we know what's really going on with someone. How do we know if it's really bipolar or PTSD? But also acknowledging at the same time there are possible or definite other conditions. We're not negating them, but it's also bringing into the fact therapeutically we can see how they interweave. So saying, for example, somebody with PTSD who hadn't realised, as Debbie said, they might not know they had a condition, but actually what you're doing are symptoms of PTSD, and based on the history we've talked about in therapy, you can now see why your relationship with alcohol was actually destination addiction. Having said, how did I end up an alcoholic? I don't know. Well, actually, yeah, let's pull it all together. The most important thing is valuing somebody as an individual, hearing their story, hearing their narrative, not judging them, but giving them that time to actually explore it and not make it this terrifying journey, making it a journey of discovery that's going to be bumpy, it's going to be difficult, but you learn to trust yourself through those times. So yeah, it's a nurturing relationship with yourself.
So, as ever on Perspectives, what we like to do, we've heard from you guys, but we also put it out to our viewers to go and give us some feedback, some questions as well. I've got a couple that I want to talk to you about today. So let's go for our first one. Now, this is from Jamie, and what Jamie has asked is, I used drugs for many years. I stopped using now, but for a long time, I felt numb or empty. Is this something people can commonly experience? Let's start with yourself on that, Debbie.
Yeah, thank you for the question, Jamie. And I've definitely worked with patients who talk about this quite regularly, that actually when they collectively are taking something away that actually gave them something, like we were saying earlier, and it can leave a bit of a void, a bit of a gap, a bit of a numbness, or however people use that language. And so one of the education pieces when people are having addiction treatment is normalizing that, and that can be an experience for people, because you're not getting the dopamine hit, you're not getting the fix, you're not getting the relationship, whatever it is it gave for you. And it's really important that people know that that's going to happen, or could happen, I guess. And then what could I replace that with? So what other alternatives? If I know what's going to happen for me, what could I lean on or engage with or start doing when I can feel that urge, that gap, that void being activated? And a bit like trauma work, you've got to do some kind of safety work first. So I think it's very normal. And I would encourage anybody to think about, what could I learn to do as an alternative, acknowledging the fact that it might not feel the same, and that's okay, because we know that that's an unhelpful engagement that you were doing before. But what could I learn that could be my new thing that I fill where I've got the void?
Brilliant. Thank you. Any other thoughts from anyone else? Victoria, about yourself?
Yeah, it's particularly talking about numbness. I can see why you'd want to uh, medicate that experience. I think people think about sadness as being awful, or anxiety being awful, but being chronically numb is, I think, quite a devastating, subversive symptom. I see quite a lot of patients that struggle with numbness, and there's a whole range of reasons why that might be. It might be because you're detoxing from drugs, but it might also indicate maybe a past history of trauma or a difficult childhood. And I have a whole cohort of patients that typically suppress their emotions very, very hard. And that might be because they've been in situations where expressing their emotions isn't safe. So they suppress them very, very hard. They don't know how they feel until that kind of bubbles up like a volcano and then has very intense emotions. And I see that picture a lot. The solution isn't substances. It's kind of longer term psychotherapy. And you have to unlearn mechanisms that have worked for you and learn more adaptive ones. And that's hard. That's hard. But absolutely can be helped.
Brilliant. Thanks, Victoria. Now, Dee, I'm going to come to you with a different question, though. And this one's coming from Ola. And Ola asked, I need some advice opening a conversation with someone who often uses alcohol as a way to deal with feeling low. They often get defensive when I try to bring it up. How can I approach this conversation?
And I feel for Ola because that's echoing the sentiments of so many people and that painful, frightening situation that you find yourself in. And there is a classic sign of somebody who clearly has a substance addiction problem, because it's one of the criteria we look for. It's one of the questions we actually ask somebody when we're assessing for addiction. Do you get defensive and angry when somebody says you're using too much? Well, it's a tick. Then that's a yes then. They're trying to protect that. So I really feel for you. And it's a very scary and loving place that you're in, because you're only doing it because you care. Sometimes it's about not giving specific examples and on this date and this date and this date. It's about gently saying, look, I just need you to hear how I feel. No judgment, no nasty language, no pointy fingers, no angry rages. You might need to see a therapist or a good trusted friend to get that out of your system first. And maybe seek support from somebody who's a professional interventionist as well on addiction. It's saying to that person how much you care about them. You're not judging them. You're sincerely worried. What can you do alongside them to help them? Maybe we can go and talk to the doctor. Maybe we can sit with a therapist, look at some good podcasts, get some good reading on it, but do it in a gentle, caring way, because the anger's going to be there, and the anger is driven on both sides by absolute fear, shame, guilt, and confusion. It's such an emotive situation. It's easy to light the touch paper. So gently, but Ola, is in a situation that so many people are in because you love that person. It hurts, but that's why you've also got to find the courage to challenge it, but not in the angry. And don't use logic. Well, you've got all this to live for. Why are you doing that? Because that will just inflame it more. Just address it. Say, I've observed it. But both of you seek support together.
Thank you. Anyone else? Anyone else got some advice for Ola?
That was really helpful advice. I think it's just trying to put yourself in their shoes, I guess, isn't it? And thinking how can I receive information in the most neutral way, and a choice of language and communication skills. So it probably is worth trying it out on somebody else first, or practicing what you can say, and owning what's going on for you. I think is really, really helpful. But I think it's a brave thing to do, and I would encourage anybody to do it. But it's the timing, it's the environment, it's how are you going to say it, what language are you going to use, what tone of voice, your facial expression. You've got to be so in this conscious space when you engage in that. You don't just do it casually. You can do maybe on a walk or something, when you're not looking at each other. Yeah, it needs a little bit of thinking through.
I was thinking that when someone is defensive, it's typically because they feel attacked. And somebody who's, for example, struggling with alcoholism, alcohol is their only lifeline. So if you come at it attacking that thing, the only thing that's helping them, then of course they're going to defend it. So I suppose it's coming at it with a aspect of curiosity and confirming your opinions that you want to help them, rather than going straight for the alcohol. When I approach very difficult conversations, I typically say to patients, I validate my own position, which is I'm trying to help you, and I validate their position, which is entering into a conversation they don't really want to be having, about something that they feel deeply ashamed about. And then generally, if you kind of verbalize where each of your positions are, then you can find a kind of middle ground.
So thank you to the panel for joining me today. Now, if you have enjoyed this, please like and subscribe on our channel for more content. And also just to update you that we're now available in audio form. So if you do want to hear us, we're available on Spotify, Apple Podcasts, and also on Amazon Music. So thanks for joining us today.